Hi, everyone. Um, I'm delighted to be here, and as Fintan said, it is an important event, certainly for us, the Mental Health Division. This topic has been around for a long time, and as Fintan said, my background is as an OT, and my experience in the main was in acute adult mental health. So I spent years going into smoking rooms and trying to get people out of smoking rooms and sitting in clouds of smoke, trying to persuade people to come and do something else. And certainly it was never a particularly enjoyable or beneficial experience, I found. I think in this job, one of the very interesting things for me is the opportunity to go around the country and look at services. I have had the pleasure in recent months of travelling around and seeing a variety of settings. And one of the things that I always look at and that I always note is the whole approach to smoking and the environments that are in these acute units in particular. Now, I know there's other units as well. But in recent times, I've been in units. So one unit, and I'm not going to name them all, I'll let you guess what I'm talking about. But in one unit, there was a smoking area that was pretty much part of the corridor. So effectively, you went out of the corridor, went out a door, and you're in this space with a kind of a concrete floor, open doors, wind and rain coming in, and two fairly young adults pacing up and down smoking. And in the same unit, there were people lying across chairs, snoozing, and there were people just walking around. And I saw very little evidence of any kind of purposeful activity. Now, I would say that, wouldn't I, because I'm an OT, but there was a lot of people lying around, sitting around, pacing around, smoking. I went to another unit, and actually this week, and to be fair to the team there, this is something that they know is an issue. 2 courtyards where people go to smoke purely. It is the only outdoor space that people go into. You walk out the door, and there were banks of cigarette butts on either side of the corridor, or of the pathway. The whole environment was grey and drab, and all you could see were cigarette butts and cigarette boxes. And I thought to myself, if I was feeling a bit low, would I want to come out here to get a break from a unit, which was very busy, generally 100% occupancy, and then this was my escape place. And I thought, no, I wouldn't. I'd probably feel far worse. And even, some of the team who were with me, we all walked inside and kind of shook ourselves because it was horrible. And I thought, that's not really something that we want to be associated with in terms of being a health service. In the same area, I went to visit community services, and I went to a campus where there are more mental health services. And in that place, there was a hostel where a high support stroke rehab. And one of the things that struck me when Mike was talking earlier, when he asked about why people smoke, and the 2 things that struck me were boredom and control over part of the life and lack of other activities, that we had a hostel, and again, people sitting there. So they were either watching TV or they were out in the smoking shelter. And this is at 3:30 in the day. And there was nothing else happening. So the only options that I could see in terms of activity at that point in time were you either watched TV or you went outside and smoked. And in the mental health services, we talk all the time about recovery. So we have a recovery approach in terms of how we're delivering our services. And in this hostel, there was a system where flasks were brought out. So here we have a rehabilitation place where flasks are brought out and people could help themselves to ready-made tea and coffee. So that was starting to great. There was no evidence of anybody actually learning the life skills to do these things for themselves, or indeed having any sense of purposeful occupation where they could actually, get some control over either themselves or the environment they were in. And I think these are just my simplistic views after roaming around the country, and it's easy for me to say, But we have to think about this, because on the one hand, we have a service. We have Vision for Change, which is our policy document, where we say our acute units should be in acute general hospitals. We're constantly on the trail of trying to reduce stigma for our service users. We talk about recovery, and we have a commitment to improving the physical health of our service users. So that's something that we have been looking at in 2014, and it's going to be clearly stated in our 2015 service plan. And yet, we live with these environments, and we let our service users live in these environments. I think, in many respects, when we get into the smoking discussion in mental health, it can become quite a hot topic because we've become quite expert in giving all the reasons as to why it would be very hard to change it. We know that in some of our acute settings we've had great success in making places smoke-free. We know that we have, come up with all sorts of imaginative ways of facilitating people smoking. But I'm not sure that as an entity on a national level, we've really accepted that this is where we're going. And I suppose the reason why I was keen to be here today was to say that that is where we're going. That ultimately, in terms of how we deliver our services, we are a health service. And certainly we are the mental health division, but we treat people in terms of the totality of their health, not just the mental health piece. And we have a responsibility to promote this. The other thing, I suppose, that I'd be conscious of is that we have we've a need to ensure that people accessing our services are treated for their tobacco addiction from the first point of contact. You know, I think it was interesting to hear Mike talk earlier on about the different approaches that they used. But that is critical for us. We have young people attending our services. We have child and adolescent services, a lot of teenagers coming through, and young adults coming into our adult units. And we have to look at how we approach people in terms of their tobacco addiction. And I know that this isn't easy. I mean, if this was easy, we'd have done it a long time ago. But in the mental health services today, we have in excess of 500 sites. So we have our acute inpatient units, we have forensic services, we have our hostels, day hospitals, etc., etc. And it is going to require a concerted effort to be able to implement this policy throughout. And it will take us some time. And I don't think that it's something that we're going to be able to do overnight. We know that we're going to have to put plans in place to be able to drive this. But I think we do need to have champions out there in our services who can assist us with this, who can work with health and wellbeing and the division to ensure that this policy can be implemented in the interest of our service users. In terms of 2014, we made a commitment to have 30% of our inpatient units tobacco-free. And certainly in 2015, we're building up the KPIs now for our service plan. But this will be a recurring theme, and we'll have a higher percentage, and we'll be looking at other environments. So it's something that we want to build on, and I think our partnership with the Health and Wellbeing Division is critical to this, because we have a good relationship with that division in terms of this policy. Denise is here already from the Mental Health Division, and we'll talk to you in a minute. But it's hugely important to us. I just want to put up one slide that I think I told you how I could do it, but I've lost the actual screen. Sorry about that. Fine. On my ramblings this week, I saw this sign, and I thought it was great. So I had to ask what it was about, and I thought, right, you know, is it an approach to smoking? So what exactly is it? And it was on a door into a day service. Now, this would be the same area where the hostel, the rehabilitation hospital, didn't have a whole lot going on other than smoking. And what I was told was that this was a door into a day facility where people came. It sounded a bit like a kind of a longer term day centre. And these times are the times that staff go past to drop in the food. So they deliver the trolleys at these times. And the staff didn't want to have people smoking at the door when they were delivering the food. But it was okay for the service users to smoke all the rest of the time at this door. Now we have to ask ourselves what that's about. There's something very wrong when we're saying that the staff can't suffer from smoking when they're delivering trolleys for the brief period they're going in and out. But there was no other sign there. There was no other sign about not smoking, giving up smoking, nothing. This was the only thing that was there. So I'm going to leave you with that. And I think we have to ask ourselves lots of questions as a service as to how we can change this and to change the culture within the mental health services into one where we proactively look at reducing tobacco and tobacco use among our service users. Thanks very much.
Thanks very much.